Yeah, so we received these tents, I believe, as a donation, and they're specifically for usage to help us during this COVID pandemic. So what we're going to be doing as a start for these tents is we're going to be using this as our assessment center. So as you know, our assessment center is going through our EMS bay, but as our volumes come up, we were just worried that there would be some congestion with the increased number of ambulances. So we decided to move out here so that we can bring our patients here, safely assess them, get them tested if needed, um, while also keeping a safe distance between them and protecting them from potentially getting the coronavirus.
So when are you going to start doing that?
So we're starting today at noon. We're going to start. Our usual triage process will remain in place. Patients will be triaged and registered, and then they'll be directed down here. They'll park. They'll come through the tent. They'll get an assessment by a nurse and a doctor, and the appropriate people will be tested and be given discharge advice and follow up.
So I noticed, according to the public health data, that testing has ramped up. So can you tell me about that? Is that in relation to the long-term care homes, or are you just seeing more people here now?
I think that testing has gone up for a few different reasons. So absolutely, long-term care testing has gone up. We've actually had some of our physicians and nurses go out and do some outreach for the long-term care places to help them with their testing. So we've gone to Mackenzie Place, Bradford Valley, Eagle Terrace. We're going to Amica in the afternoon today, Sunrise, and some of the group homes in our community to support them with the testing and the assessment of patients who may have COVID, especially the places on outbreak. And then some of the testing has gone up is because we just know more about the virus. So specifically what we know is that the virus is present in people with minimal or no symptoms. And really, we've got to test people so that not only can we identify positive cases, but so we can mitigate their spread to other people. And that's likely why the testing is ramped up. And then the last reason is because we have more tests now than ever before, and our capacity to process the tests has gone up. Our volumes have increased a tiny bit. We're still down from what we were before the coronavirus, but we are seeing more people coming to be tested. To mitigate that, like I said, we did do an outreach to the long-term care to test their residents and their staff so that they wouldn't have to come in here. We felt it was a more convenient way to look after them. But we don't want people who have other symptoms like headaches, chest pains, acute traumatic injuries to feel uncomfortable to get care in our main emergency department. And that's part of the reason why we're here, so that these patients can get seen and assessed, but those patients won't have that fear of coming to the hospital and being exposed.